Hello, this is Dr. Live with New Insight, and thank you for joining me in another video. Have you or anyone you've known experienced depression? How long did it last? And what treatments or interventions help you to cope or manage or recover? Let's discuss some depression myths and coping mechanisms. Myth number 1. When you're depressed, you lay in bed all day and cry. Although fatigue, loss of interest, lack of motivation, and crying spells are all symptoms of depression, not everyone will exhibit these symptoms. There are many individuals who have what is known as functional depression, and they are very active, energetic, busy, they are goal-directed, they are able to achieve emotional regulation, and properly attend to their day-to-day activities. Myth number 2. The only way to treat depression is with medication. This is not true. However, medication may be warranted depending on what is known as the acuity level or symptom severity of the depression, which is determined by many factors, including onset, frequency, duration, and intensity of symptoms, and other genetic and contextual factors. According to evidence-based practices, the best course of treatment for depression is combining both medication and therapy. They each play a vital role in managing symptoms and in coping. Medication has its unique role, and therapy has its unique role. And there are certain aspects of depression that medication cannot treat, such as processing thoughts and feelings, cognitive restructuring, decision-making, learning and implementing coping skills, and forming new habits. And there are certain aspects of depression that therapy cannot treat or address, such as chemical imbalances. Myth number 3. Depression will never go away. Depression can be resolved. However, again, it depends on the type of depression, acuity level of depression, and the treatment or interventions one receives, and so many other contextual factors. Depression can be mild, moderate, or severe. And even though the depression can improve or go away, this does not mean the person won't ever feel sad or experience negative emotions such as frustration, disappointment, setbacks, and so on. But if and when they do, however, the stressors won't ruin them or their life. You'll know how to process and deal with your stressors accordingly. So be certain to address the root cause, understand your triggers, and understand that you may have to face and talk about and work through some very sensitive and difficult issues. You may also need to forgive, to let go, to work on your self-esteem, to work on your self-confidence. You may need to learn to validate yourself from within, to be more assertive, to set healthier boundaries, to establish healthier connections with others. And remember, it's not about quantity when it comes to connection and relationships. It's about quality. It's helpful to have at least one person, someone you can feel safe with, unjudged, and supported by. It's also important with depression to determine if your own thinking is working against you, if your own habits are self-defeating and worsening the problem, and determine if you have relationships that you need to let go of. Know that no matter how dark it seems, how weighed down you feel, how the thoughts have convinced you that it's a lost cause, I'm here to tell you from personal and professional experience that you can and will see brighter days. There is definitely light to be discovered, but you have to face that which you fear the most, that which makes you the most uncomfortable, that which is challenging, and really be prepared to put in the energy and effort to make the changes that are necessary. And as always, this will require a growth, solution-focused mindset. So I hope this helps, and be sure to check out my previous videos on coping, emotional regulation, stress management, forming new habits, and others. Like, comment, and subscribe, and we will talk soon.